With us today is Robin Deeter, Mobile Crisis Supervisor at Meadville Medical Center. Robin, thank you for being with us.
Thank you for having me.
Before we get into things, tell us a little bit about yourself.
I've been here at the hospital for 7.5 years now. I originally came in for the drug and alcohol portion of the hospital, but have always continued my roots of, I did mobile crisis 10 years prior to coming to the hospital. So I have remained in the ED doing the mental health assessments there. So I've been in the mental health field for about 28 years.
And how did that start? What said that this is the path I want to take as a career?
Well, that's a good question. A job kind of fell into my lap. The first job was a mentoring position, so it was mentoring troubled kids that had low-income families who really didn't get out in the community and know what's in the community. So I had the privilege of being able to introduce kids to new activities and free activities, and it kind of snowballed from there. I got a degree then, and so then I was doing wraparound services in the school districts, and then I had met somebody that was doing mobile crisis and started that part-time, and then it became full-time for 10 years.
So Robin, that leads you to Meadville Medical Center?
Mm-hmm. Yep, and so back in April of last year, the county had approached us to consider taking on the mobile crisis contract, which is a contract through the county. And so in April, they started working on moving towards that. And then in October, we were awarded that contract. So we've got to build this program from the ground up. It's taken a little bit longer than anticipated, but so policies, you have to be licensed through OMSA. And so it was a process, but as of the first of the year, we were kind of taking it on part-time. Butler County was assisting. I started off with a full-time staff, myself, and a per diem. So to cover 24 hours a day, 7 days a week is a little difficult with that. So they continued on. So we were able to kind of gradually start into the contract as folks became part of the team. And April, we took it over 24/7.
Wow. That had to have been challenging, but also maybe a challenge you were willing to accept to kind of work on something from the ground up.
Yeah, and kind of the benefit that I had is we wanted to move it back to how it was done when I originally did it for Stairways had the contract. So it was a natural transition.
So we're going to be talking about mobile services, but how does that fit in the overall picture here at Meadville Medical Center?
So when somebody has a mental health or a substance use crisis out in the community, we go out in the community. We always look at least restrictive, so whether it be resource information for them, whether we help them get set up with outpatient treatment, if we have to look at voluntary inpatient treatment, involuntary inpatient treatment, if for any reason we have to come into the emergency department, we follow them in and follow them through the process, which the provider beforehand was not doing that, so a lot of information was getting dropped. And so we just wanted to bridge that communication gap, and I think that's probably been the biggest benefit besides reconnecting with the community.
So for those who might not understand, your department, you're actually going out into the community as opposed to somebody who might be coming in and then receiving services internally?
Yes, so we meet folks where they're at. Most of the time that's their home. We've been to doctor's offices, we've been to our outlining buildings. As long as there is a place that we can meet with that person in private, we can meet them at any place within the county. So it just provides them, they're comfortable in their own environment, so it leads to a better assessment.
Are they calling you directly? Is it through a doctor that's making that referral? How are you knowing what's out there and what resources you're sending out into the community?
Sure. We have a hotline. It's been the same number for years. We did retrieve that same number, so folks call us, whether it be for themselves or for loved ones or friends, family. anyone that's having a concern mental health wise, they call us. And so everything for the most part starts out as a phone intervention. And then based on the information that we're given in that, kind of determines whether it's appropriate for us to become mobile and go to where they're at to do an extensive assessment, or if there's referral information or ideas that we can give them over the phone. As of July, we also have incorporated a walk-in facility. It's located at Grove Street, and so that may not necessarily start by a phone, but we have used it periodically, just because somebody may not want family members that are at home involved, and so they would prefer coming in and chatting with us. So for the most part, we're in the community, but we do have the ability for somebody to come and talk with us.
Can you kind of give us a snapshot of maybe what would qualify under behavioral health, or what those needs that you would serve? I think there's such a range.
There is.
Can you kind of give us a little bit of what that involves?
Yep. So the least restrictive would just be referral sources. So we can refer them to any type of service in the county. So CHAPS, which is a mental health provider, they have some great programs. Family Services has some kid-related stuff that we refer to. We also then refer to Mind Body Wellness, Meadville Behavioral Health. And then for those more extreme cases where somebody is currently suicidal or homicidal, or just a complete inability to care for themselves, those are the times that we would then look at inpatient, whether it be here or a different facility, and then the options of that would be whether it be voluntary or involuntary.
There's certainly a need, and if you look at the community and you talk to these organizations, they're telling you they're busy. Mm-hmm. What's it say for the county, and what would you say to somebody out there who may be struggling, to let them know that there is somebody here that they can talk to?
Yep. All you have to do is reach out. There's, the hotline is 24/7. It's answered. If my staff is not in there at the time, it then rings up to the inpatient mental health, so somebody's always answering, and we would reach out. But you know that you're wanting help, needing help, and all it is a phone call.
Robin, with the staff that you have, what are some additional needs that you might be looking for?
So we are looking for a fifth full-time staff member. They will come into a rotation. The staff works 3.5 days a week. We will be rotating in a full week of Monday through Friday, 9 to 5 for the walk-in facility. So that's the purpose of the fifth full-time person. We are mainly focusing on those that have 4-year degrees, generally in psychiatry or psychology or social work, something along the social services areas. And OMSA does allow some deviation for that, so the best thing would be for you just to apply if you're interested, and then we can look at stuff. But we're really looking for somebody with strong communication skills, documentation skills, active listening skills, and the ability, obviously, to work under pressure because we're in a crisis situation, and be able to make sound decisions, and then just the knowledge of trauma-informed care, mental health conditions, and community resources are a bonus.
A challenging career, but could be very rewarding as well.
Yes, it is very rewarding.
And how do they apply?
It is on our website. We ask that you have a 4-year degree, preferably in a social services, but the OMSA regs, of which we have to follow and are licensed by, there is some deviation from that. So the best bet would be to apply if you're interested, and then we would look at everything and determine whether we feel that you meet the criteria for the OMSA regulations.
And if somebody had questions about the position, could they call and have a conversation with you?
Yes, most definitely. Yep, you can leave, if I don't answer, you can leave a message on my voicemail, but yep, I would be more than happy to answer any questions. You can email them to me, whatever is easiest for anybody.
Anything else we should know about what you do, your department?
I think that we wanted to make this a service that the community used. It had kind of dwindled down to where it wasn't really being used. So we just want everybody to know that it's out there. We're, reverting back to an older way of doing things. In the month of May, we more than tripled the mobile calls from the provider previously. So the numbers have been very high, which is good for us and good for the community because those people are now being able to get help.
And it can be a range of things, right, that people are calling you about. So
Yep, they can call mental health, they can call substance use. We have had just simple calls of, do you know doctors that are accepting patients at this time? So it can be really pretty much anything. Our focus is mental health and substance use.
Okay. Robin Deeter joining us. And again, if you have questions, you can go online to get more information. Robin, it was a real pleasure. Thank you.
Thank you for having me.
Yeah, all the best.
Thank you.
And thank you for being with us as well.